Good evening and thank you for attending my presentation. My name is Daniel Anderson. I'm a registered nurse working at an acute care facility here in Mississippi, and today I want to talk to you about the National Opioid Crisis. It is my goal that through this presentation you'll be able to describe what the opioid crisis is, explain the impact that the National Opioid Crisis has on the healthcare industry, identify the signs and symptoms associated with opioid abuse, identify ways that your organization and your community are combating the threat against health, and understand how you can make a difference in this crisis. To start off, we'll look at a timeline leading up to the National Opioid Crisis. In 1861 to 1865, the use of morphine as a battlefield anesthetic led to many soldiers with a morphine dependency after the Civil War. In the year 1898, the Bayer Company produced a commercial form of heroin, which was believed to be less habit-forming than morphine. In 1914, the Harrison Narcotics Act required that all doctors write prescriptions for narcotic drugs, such as opioids and cocaine. In 1924, the Anti-Heroin Act bans the production and sale of heroin throughout the United States. In 1970, the Controlled Substance Act created a grouping or a scheduling of drugs based on their potential for abuse. For example, heroin is a Schedule I drug, whereas morphine and fentanyl are Schedule II drugs. A Schedule I drug is a drug that has no medical benefit and has a high potential for abuse. On January 10, 1980, there was a letter that was published in the New England Journal of Medicine entitled "Addiction Rare in Patients Treated with Narcotics." This letter was produced as a study, but it was not a true study, and with it they made claims that there was no risk of addiction associated with the treatment of narcotics for pain. It was in 1995 that OxyContin was released, and it was aggressively marketed as a safe pain pill because it released its drug over the course of 12 hours. This drug was actually produced by Purdue Pharma, and on May 10th of 2007, the federal government brought criminal charges against Purdue for misleading and advertising that OxyContin was safe and less addictive than other opioids. The executives of Purdue pled guilty to charges of misleading and defrauding physicians and consumers and paid $634.5 million in criminal and civil fines. Through this chain of events, we led to the National Opioid Crisis. According to the United States Department of Health and Human Services, during the 1990s, pharmaceutical companies claimed that patients would not become addicted to pain relievers. This led to healthcare providers aggressively prescribing these narcotics, and this ultimately led to the discovery that these medications are highly addictive. And in 2017, the president declared a public health emergency so that we could combat against the opioid crisis. Okay. All right. So according to the market research firm IMS Health, opioid overdoses account for 42,000 deaths in the year 2016. This is an average of 116 opioid overdoses per day. The number of opioid prescriptions increased from 112 million in the year 1992 to 282 million in the year 2012. There was a new term coined called the opioid use disorder. This is a clinical term used to describe an opioid addiction or abuse. People dependent on opioids may experience withdrawal symptoms that we'll discuss later in the presentation. Dependency is also coupled with a tolerance, leading to an increase in the doses that these patients are taking and outsourcing for a different source of pain relief. This often leads to these users switching to heroin. Heroin is less expensive than prescription drugs, and according to the National Institute of Drug Abuse, it's estimated that half of the young people who inject heroin turn to the street drug after they started abusing prescription painkillers. Overdoses related to heroin increased by 533% between the years of 2002 and 2016. This is an average of 15,469 deaths per year. According to Fair Health, the opioid crisis has had a significant impact on healthcare in terms of cost. Aggregated professional charges rose from 71.66 million to 721.8 million in just 4 years. The cost of burden is significantly higher on patients who have an opioid abuse dependency because their diagnosis is usually coupled with other comorbidities and a greater increase in the utilization of healthcare services. Billing charges also increased throughout healthcare. Between the years of 2011 and 2014, alcohol and/or drug services increased by 1,189%, laboratory tests increased by 848%, and the evaluation and management of treatment increased by 335% in association with opioid abuse and addiction. There are several signs and symptoms associated with opioid abuse. Some physical signs include a noticeable elation or euphoria, a marked sedation or drowsiness, confusion, constricted pupils, slow breathing, an intermittent nodding off or loss of consciousness, and constipation. Some other signs that could be seen in patients could include doctor shopping, shifting or dramatically changing moods, extra pill bottles found on the person or at their home, social withdrawal or isolation, or sudden financial problems. It's also very common for people with opioid abuses to go through withdrawals. Some withdrawal symptoms associated with opioid abuse are headache, nausea and vomiting, diarrhea, sweating, fatigue, anxiety, and an inability to sleep. These symptoms often mimic flu-like symptoms and are misdiagnosed in our emergency rooms. Okay. There are several events after the initiation of the opioid crisis that lead to how we are combating against this healthcare issue. On May 20th of 2015, Operation Pillution was the largest prescription drug bust in the history of the Drug Enforcement Administration. 280 people, including 22 doctors and pharmacists, were arrested over the course of a 15-month sting operation. On March 18, 2016, the Centers of Disease Control and Prevention published guidelines for prescribing opioids to patients. Some of these guidelines include the use of over-the-counter pain relievers such as acetaminophen or ibuprofen in lieu of the use of opioids, and also the promotion of exercise and behavioral treatments. On March 29, 2017, President Trump signed an executive order calling for the establishment of the President's Commission on Combating Drug Addiction and Opioid Crisis. On July 31, 2017, President Trump declared a national public health emergency to combat on the ongoing opioid crisis. On September 22, 2017, CVS pharmacies announced that they will be implementing new restrictions on the filling of new opioid prescriptions. Some of these restrictions include limiting a 7-day supply to patients with a new prescription for this pain therapy. On November 1, 2017, the Opioid Commission released a final report that included 56 recommendations, including a proposal that established a nationwide drug court. These courts would aim to make addicts into rehabilitation programs rather than sending them into prison for possession of narcotics. In addition, in 2018, on February 9th, President Trump authorized a $6 billion opioid program. This would expand over the course of 2 years to combat against the opioid crisis. On February 27th of this year, Attorney General Jeff Sessions announced that the Prescription, Interdiction, and Litigation Task Force. This task force mission was to support local jurisdictions who had already filed claims against prescription drug makers and distributors. On March 19th of 2018, President Trump administered outlines for an initiative to stop the opioid abuse and initiated an ad campaign that would course over the course of 2 years. On April the 9th of this year, the U.S. Surgeon General announced an advisory recommending that Americans carry opioid overdose reversing drugs such as enoxaparin. On May 1st, 2018, the Journal of American Medical Association published a study that finds that synthetic fentanyl has surpassed prescription and heroin as the primary cause of overdose fatalities. On June 7th of this year, the White House announced a multi-million-dollar publication to spread the awareness of our fight against opioid addiction. You may have seen some of these ads. It started out with 4 ads that were showing the lengths at which young people go to in order to obtain these powerful drugs. You too can make a difference in the opioid crisis. Nurses and other healthcare professionals can help by screening and monitoring the substance abuse and mental health problems. Prescribers can prescribe opioids only when other treatments have been insufficient. Prescribers can also prescribe only amounts needed based on treatment and length of the pain. It's also important to talk to patients about safety in using, storing, and disposing of prescription painkillers. It's also important to enforce prescription drug monitoring programs and to follow accepted medical practices in terms of medication, dosage, quantity, and refills. Are there any questions? Again, my name is Daniel Anderson. I'm a registered nurse. I do appreciate your time with my lecture today. If you have any questions, I do have some resources available for you that you can further research this topic, or if there's anything you'd like to discuss, please see me afterwards. Thank you.